Okay. Well, thank you to so many of you. Some of you I've met before, many of you I haven't. I'm Kate White Tudor. I'm the advocate and legislative liaison for the Washington Association for Area Agencies on Aging. And it's my great pleasure to update you about what we are planning to accomplish and looking for your help to help us accomplish in 2024. There is a little snow still on the ground in Olympia, not quite as much in this picture. And if you're coming to travel here in a couple weeks, who knows? We have some more tonight, but I figured that this was the view many of you might have if you were coming to Olympia early in the morning to be advocates sometime in the winter, which is when our session is meeting. I want to make sure that you are aware of the brain trust that goes behind our policy at W4A. Lynn and Kathy, would you like to introduce yourselves?
Sure. I'm Lynn Kimball. I'm the Director for Aging and Long-Term Care of Eastern Washington, and I serve as our association's legislative chair.
And I'm Kathy Knight, and I staff the State Association for the 13 Area Agencies on Aging.
This is a little outline of what we're planning to talk to you about today. Case management is a topic that is probably familiar. If you've been advocating with the area agencies on aging before, you know that case management is one of those programs that is a mainstay of taking care of clients in the Medicaid program who are low income and experiencing a level of disability that means that they qualify for the state's long-term care program. Our case managers help manage that care. We help find caregivers for people. We help provide services that keep them safe in their homes. And that program continually needs to be tweaked. And so it's a much smaller request for it this year than we've had in past years, but it's still on the agenda. This year, we are also eagerly pivoting to work on a pending crisis in funding for nutrition for our programs to serve people with disabilities and seniors living in our communities. We're going to go over some tips and tricks and information about meeting with legislators, whether you meet with them in person or in Zoom. And we're going to leave lots of time for your questions at the end because they are the most interesting and educational part of the whole thing. So I perhaps led a little bit into this in my last comments. This is a bit of context for case management, but I think the real key when you're talking to legislators is to say, we are caring for clients who live in their homes, not in facilities. They have heard a lot from the nursing homes, assisted living providers, the adult family homes. They're all looking for more money for their rates, and they need it. There's a workforce crisis that affects all of us. They need to pay more to hire people, but we are caring for the folks in their homes, and that's the majority of people receiving long-term care in Washington state. About 2/3 of them are receiving those services at home. That is much better for people's dignity. It allows them to stay connected to their family and their community, and it's lower cost than it would be to give them those services in a residential facility. So the state saves money by keeping people at home, and people benefit from it. But it doesn't mean that people aren't receiving very high levels of care. Everybody who qualifies for Medicaid long-term services and supports has qualified in meeting a nursing home level of care, meaning that they need assistance with at least 3 activities of daily living, and probably many more. And so those folks receiving services at their home are at a very high level of vulnerability and disability, and we are doing a really wonderful job in Washington state in providing services at that level in people's homes. And as I said, it's about 2/3 of our total population that we serve through the Medicaid program for long-term care. There are a lot of challenges with our workforce crisis. This is a theme that legislators are hearing across the board from all kinds of different providers. The nursing homes are talking about the workforce crisis. The long-term care providers in the homes like us are talking about the workforce crisis. There's a workforce crisis in primary care and behavioral health care and child care in all kinds of settings, because wages have risen as they've needed to, and people are looking for different types of work in the wake of the pandemic. And it's been a real challenge for those of us looking for hands-on caregivers and providing supports to people with disabilities in the community. So the Aging and Long-Term Services Administration, that's ALTA at the state, they have asked the area agencies on aging to take on a new population of clients for long-term care. In the past, we've only received those clients when they had an in-home care provider assigned to them. Like we got the client and the caregiver as a package, and we helped make sure that that caregiver was scheduled properly, that if they needed to take a break for their family, that we got backup help for the client. We put in the wheelchair ramps and the grab bars and help do medication deliveries, hot meal deliveries, whatever it is that that client needed besides that hands-on care. But now, because of the workforce shortage, the agency is asking us to take clients who don't have that caregiver in the home. So we can provide all of the services we provide to that client. And in addition, we're going to be helping to interview their community, their family, their neighbors, their loved ones, anybody who might be able to spend, who would want to be paid to provide the long-term services that client needs and could be connected into the system to be employed as an individual provider. So we're going to be doing that extra work to help find those hands to be present in the home for that client. And in the meantime, we manage all the other services that will help family members who are taking time off or other volunteer supports that they have. But it definitely takes our case managers longer to ensure that those clients are safe in their homes while we're also trying to get them that hands-on support. So we have partnered with the agency to ask for a small amount of additional money for this program to help us get a little bit more case manager time to do that extra work for these clients who don't have caregivers in the home. Here's our request. It's 2.58 million. That is state funds. 2.58 million general fund. That means the total ask in this budget for the year of 2024 is about 5 million in total funds, but half of those funds will come from the federal government. And it will help reduce the ratio of clients per case manager from 75 to 1 to 55 to 1 for those folks who are yet to get hands-on care in the home. And that's going to be an ongoing funding, but since we're only asking for the supplement, this is a supplemental year in the budget. This is a little budget wonkery, but the state writes 2-year budgets. They already wrote the big 2-year budget last year. We are just updating it to reflect the 1 year we have left here in 2024. So this is a 1-year funding amount. Do we have any questions or comments on case management? I would love to get some questions answered now if folks have questions before pivoting to our next topic. I see Alex.
Hi there. I'm wondering, is this asked, I know this is for just 1 year of the supplemental budget, but is this something that could become this 2.5 million ongoing dollars for this case management? Because as we've seen, you know, when it's only one-time funding, the need doesn't go away. It's just that the funding might go away after 1 year, and then that leaves people in a bad situation. So I'm just wondering, is this an ask to also include this 2.5 million in the base for future?
Yes, yes, absolutely. Fantastic question, Alex. Thank you so much. Yes, we hope this will add to ongoing funding as long. Oh, somebody, thank you, thank you. This is ongoing funding as long as we need to be serving these clients who don't have caregivers in the home, but it's based on that population. So as we succeed in getting people caregivers, and if and when we get this workforce crisis under control, the amount of money will go down because it's based on that population.
I did.
So Linda, I see you next. Linda from Snohomish.
Hi. Hello. I'm wondering if you would say again what it is before it's reduced to 55 to 1. And then the second part of my question is, I imagine case managers would have a mixture of clients with caregivers and without. So how will they do a percentage of that caseload ratio?
Those are both great questions. So the current ratio is 75 to 1.
Mm-hmm.
And we think that's too high, but it's better than it used to be. And it's going to have to be averaged out because Some agencies are quite small and they may or may not be able to hire an additional person just to spread the load on their averages. If it's a bigger agency, maybe they get an extra FTE out of this, but it's going to have to be average because, as you said, you can't segregate the caseloads. It's just a little more money to hire more hands on deck, and they will share those cases based on the burden each case presents. Because certainly there's a lot of variety in how much support people need. People without caregivers need a lot of support. But as you know, and have advocated before, like people who are experiencing severe mental illness also need a lot more support. And there's people who are facing an eviction notice who need a lot of support for a while and then may get to a more stable place with our help. So it's all going to contribute to our capacity in hiring some more people statewide, and where they get fit will depend on how many of these clients they have. So great question. I see Stephen, I believe.
Yes, thank you. Excuse me. I'm interested. I understand the case management caseloads are very high. And I also understand that one of the major problems is the lack of caregivers in the home that might reduce the amount of case management required per client. And we've been thinking about asking for AAA funds to hire domestic workers, which the current state rate is too low to attract, and supplement it with private fundraising. And I'm wondering what you think of. I know we're not going to deal with that this session, but what would you think about that as a longer term strategy?
I would love to learn more about it. That is something that I wasn't aware was a priority for any of our agencies, and I would love to bring that into the conversation over the summer so we can figure out if it's a need across our system and whether we want to make that one of our budget priorities for the next year. I think that 2025 is a good year for implementing newer services. It's another 2-year budget. So I really hope that you will make sure that information gets up to Kathy Knight, where she'll be able to share it with our policy team. Thank you.
Definitely will. Thank you.
Elizabeth. And after Elizabeth, I think we're going to move on to our next topic, but please, Elizabeth.
Is this Elizabeth Rohr?
Ah, the one that says Elizabeth Rohr on the screen. I can only see the top of a head that doesn't have very much hair.
It's
So
Greg Rohr.
if you want to introduce yourself, that would be helpful.
I'm Greg Rohr from Lewis County, AAA, part of their team. I
Thank
had some
you.
questions regarding the breakdown of the case management, if that includes the construction of ramps, materials, or if those are separate contractors, including grab bars and any other infrastructure needs like that, which requires, and also are you requiring what kind of certifications are you requiring for people to do that kind of work, and who do you contact? That is kind of my questions of that 2.58 million that you're talking about from our state. How much of that goes to the construction of actual sites at this point?
That is just for funding salaries for case managers.
Right.
If they are organizing construction on behalf of a client, they'll do that with ALTA's program for contracting with contractors and service providers in the community. And I would suggest that you contact the Lewis Mason Thurston Area Agency on Aging. I'm sure they put these contracts in place all the time for clients across all of those counties, and they're familiar with the process of figuring out how to get qualified as a provider with the system.
I was just curious as to how that broke out in the funding, if that was included in it or separated.
It's not. That funding is just for salaries for case managers and their benefits.
Okay, one last question, if I might.
Sure.
As far as the case management goes, how much of a breakdown from your side are you seeing for the aged or the elderly compared to mental health or homeless at this point?
That's a great question that I would want to pass on to Kathy Knight to perhaps research and get back, because I don't have that breakdown at my fingertips. If somebody else does, Lynn, you're our data guru, so if you've got an answer to that question, I'd love you to chime in. But otherwise, I would love to just, yeah. What do you
Yeah.
think?
I'd say in the past, it's been probably 60 to 70% of our caseload is over the age of 60. And then we have the rest is the younger population that's 18 and older. And so somebody can be on the program for all sorts of reasons, not just mental illness. It can also be from a traumatic brain injury and needing assistance. It can be from accidents and needing lots of help with activities of daily living. So it is a pretty wide variety of populations, but it does tend to be 60 and older for the most part as people need more support as they age in their homes.
Are you seeing any differences come up now with that percentage changing recently, or is it staying pretty steady at 60 to 70%?
It's been staying pretty steady. We have seen over the years increased client complexity. And I think that's where this request really comes into play is there is a workforce shortage, less caregivers available, more complex client situations that have lots of hours or just challenging ones to staff. We are seeing more and more people who are on our caseloads who need help finding a caregiver and getting other supports in place as they wait to find a caregiver.
And then as far as the certification for caregivers go, is there a process for you to screen? Because you had mentioned neighbors.
Hey, Greg, I would appreciate it if we could take this conversation offline because we do have a bunch of questions on
Got it.
other topics and things to cover. This is great information to ask Kathy Knight at the Area Agency on Aging for all of us, or to Nicole Kidu, is the CEO of the Lewis Mason Thurston Area Agency on Aging. And I love your enthusiasm and curiosity. This is super, super, but I want to make sure we get through for everybody else. I do want to call out, we have 2 legislators who've agreed to be our champions for this case management request. We have Alicia Rule from the 42nd Legislative District, that's Northern Whatcom County. She has agreed to be our House sponsor for this budget request. And a big shout out to Amanda McDade and her team at the Northwest Regional Council for securing her support. And Senator Ron Mazzal, a Republican from Whidbey Island, is going to be our sponsor for this budget request in the Senate. So I appreciate how Senator Mazzal has been a huge champion on case management over many years. He helped us with the enormous success we had a couple years back in getting 24 million additional in funding for that program. And I'm delighted to be partnering with Senator Mazzal and Representative Rule this year. So I'm going to move us on. Kent, I see your hand up, but if you could hold that till I've presented on the nutrition issue, that would be really helpful. We are delighted this year to be partnering with a wide coalition to be asking for significant investments to sustain the senior nutrition program in Washington State. As you know, the area agencies on aging are key in providing group meals in the community, as well as home delivered meals to people who are not able to make it to a group setting. And there are so many heartbreaking and moving stories that I hear in the work that we've been doing around developing this priority. I'm just going to share one of them. The folks in the agency who shared this story, thank you so much for bringing it. Mary, I'm not talking to, this isn't Mary in the picture, but you can think of her as Mary. Mary was a nurse for 40 years. She understands the importance of good nutrition, but over the past year, it's been harder for her to afford high quality food. She said, inflation caused a great change in my life. After 6 months of eating mostly Cheerios and tuna fish, a friend helped her sign up for meal delivery through Meals on Wheels. Mary said it saved her life. She said, I'm alive because of what you folks do. I was probably going to starve to death. Now I've got actual real food to eat every day. And in addition to the nutrition benefits, the meal programs really do a lot to combat loneliness. Loneliness, as folks know, is very harmful to people's health. There's research all over the place that shows that it's as harmful to your health as smoking 15 cigarettes a day. And our group meals are a fantastic source of connection and community for people, and it improves their health. Here's a story that folks shared from Pasco. They have a site that serves Hispanic meals a couple times a week. One gentleman took one of our providers aside, excited. He had just come back from his doctor who said, whatever you're doing, do it. The meals have helped him bring his diabetes under control. He comes to the meal site with his friends and he's eating vegetables regularly for the first time in his life. He says he now brings his friends to the meal site to get healed. And there are people who can't make it to those group meal sites, and their deliverer of a hot meal may be the only person that they get to see on a regular basis. This helps connect them to the healthcare safety net. That person delivering the meal may be able to see that there are other needs that they could address. I got a lovely story from our folks in Richland. We got a call from a daughter who was concerned about her mom, who was widowed about a year ago. Her mom was struggling with depression, and her daughter said she was wasting away. So we had sent Meals on Wheels out to serve her, and at first she would barely open the door to take the meal. But over time, she got to know the volunteers, and she built friendships. And today, she is actually one of those volunteers who delivers meals and goes to the group meal sites where she runs a widow support group with her friends. We are facing a huge cliff in our funding. The federal funds that have sustained these meal programs through COVID are running out this year. And there's over 18,000 people in Washington state that we are currently feeding who will lose these services if the state doesn't act. So this is our request, is to fund $15.2 million to sustain senior nutrition services through the area agencies on aging, which will include people that we serve who are living with disabilities who aren't seniors. I'm really excited about our coalition. I should have put up a slide with our coalition members in it, but AARP is participating with us, the Alzheimer's Association, the State Senior Citizens Lobby. We also have the Anti-Hunger and Nutrition Coalition, Northwest Harvest, Food Lifeline, and the Faith Action Network. They are all partnering with us on supporting this request, and we are delighted to have championship for the 24th Legislative District that's out on the Olympic Peninsula, served by the Olympic Area Agency on Aging, where there is a huge crisis in rural food access. And our Senator Vandeweghe from that region is going to be our Senate sponsor for this budget request, and Representative Mike Chapman, who also represents the 24th district, is going to be our House sponsor for this request. Representative Steve Theringer, the third member from the 24th district, runs the Joint Legislative and Executive Committee on Aging Services, and he's been on the board at Olympic Area Agency on Aging in the past. He's been a county commissioner out there. He knows these issues well, and he is positioned to help make sure that his colleagues' requests get good consideration in that budget conversation. So I'm going to pause here for questions on the senior nutrition request. I know we had a bunch of great questions on case management. I look forward to them. Alex, again.
Do we know how the 15.2 million might be distributed amongst area agencies across the state, or will it be an RFP process?
I think it's going to backfill existing funding that just came from other sources. It's not hopefully going to change anything about programs. It'll just mean we don't have to cut people off.
Oh, that's good. So perhaps it could be kind of envisioned as contacting the agencies that received these federal funds, and then just telling them, now we'll give you X dollars to backfill that, for example?
Yep, exactly. Okay. We hope that for the folks who are providing these services, we'll be able to continue those contracts and services exactly the same way as they've been in the past. Our source of funding will be different.
Yeah, that would be great, because it would lessen the burden on the agencies to not have to do another request for proposal. Not only the area agencies, but also the organizations that are going to need to potentially, or that typically have to request the funds from them and do a whole another grant request. So that would be awesome. Thank you.
And Kent, thank you for your patience.
Yeah, you can do this later, but could I get the names of the sponsors and the partners?
Absolutely.
Good talking points next week.
When we are off camera, I will show you a picture of our one pager. It is on the W4A website, and that has logos for all of our coalition partners on it. But it doesn't have our budget sponsor names. We're going to need to include that in our email out to all of you with our thanks. Any other questions from folks?
Yes, I have one.
Please.
Am I incorrect? Hasn't Governor Inslee inserted it in his supplemental budget for this or something like 7 million? And so we are asking for an increase to 15. Am I incorrect?
Thank you. Yes, you are so right, Dennis. You are on it. Governor Inslee did fund in his governor's proposal senior nutrition, and he said it would cover 18,000 people, which is the number that are at risk for losing their services. However, he got the number wrong. So we are making sure that our budget writers get the correct number, but that is actually a really important point for us to make, which is that Governor Inslee has said that he wants to fund services to ensure those 18,686 people. And you don't need that detailed number. It's fine, just 18,000 plus. Don't lose services. I am aware that there are many area agencies on aging that are building wait lists for nutrition services. King County is building a huge wait list. I think it's near 1,000 people at this point. This money is not going to be able to serve the folks on those wait lists. It was a very tough strategic decision for us to size it to be sustaining services rather than adding services. But I hope that we'll keep working this priority and perhaps get funding for those additional people next year. I don't want them to have to wait a year for a meal, but you know, it's a weird legislative game we play. Dennis, I see you have more.
I have one additional question. The legislators that you cited, am I assuming that they're going to introduce companion bills for this? And if so, when will we know what those bills are, the numbers?
This is a budget request rather than a bill. So we're not
Okay.
going to have a number for the bill aside from the operating budget.
Thank you.
So the operating budget requests are due into the budget writers by the end of this month, and we will see about the third week of February the initial draft budget proposals from the Senate and the House.
Thank
And
you.
hopefully we'll see it on both sides. And if we don't, we will negotiate to get it included in the final budget. But I have a lot of faith in the strength of our champions to get this done. Kent, I see another question.
Mistake, sorry.
Anybody else? Then I will go on to our legislative visit information. Many of you been to these legislative visits. They may be in person or virtual. They work very well in both formats, in my experience. What doesn't work so well is if you're trying to hook somebody virtually into a live meeting. That gets quite awkward and funky. So if you have some people at home who want to join a meeting with folks on campus, that may not work. So I suggest that you adopt one strategy or the other, and hopefully you have appointments, because it's very difficult to get these appointments. I have been struggling myself, and some of my requests back in November are still unanswered. So they are still digging out after, this is the second week of session now. And so legislative assistants are still trying to figure out what they can fit in and when. They will prioritize your requests because you are constituents and represent services serving their constituents. So please make sure that you share the visit information for any visits you make with Rebecca and with Kathy at the W4A, because then it's possible I may be able to jump in with you and help secure or thank or find specific strategic guidance from the legislators that we're talking to. That your visits are an incredibly useful opportunity for all of us to share this message widely. Here are some of the basics about what to expect to do in your visits. You definitely need to tell them who's in the room. They're all very curious. They'll want to know where you're from. So please make sure that as soon as you've gone just around with introductions that you get into our requests. It's pretty simple. We want 2.58 million general fund for case management, and we want 15.2 million for Area Agency on Aging nutrition programs. The governor funded it, but not enough in his budget. That's the correct number. And then, you know, if they have questions, answer them if you know. If you don't know, that's actually a wonderful opportunity for me or Lynn or Kathy to follow up with them and remind them about our issues again and get that answer to them. And do invite them to come visit your Area Agency on Aging, visit with your advisory council. If there's chit chat about who lives where, I know that often happens in these meetings and it's really fun, but make sure you cover our priorities before you get into that. Just say, yeah, it'd be really fun. Like, yeah, I know that coffee shop down the street from your office, but we want to make sure you know that we need 2.58 million general fund for case management for clients without caregivers, and we need 15.2 million for senior nutrition services. And then we can go back to like figuring out when and how you might visit with them in the district. I think I probably previewed this, but we do want to know what your legislators' feedback is. I know there may be a sign-on letter circulating to support our nutrition request. So if folks say that they're interested in helping sign on to a letter or help in some way, that will help us guide that letter to them to make sure they get an opportunity to express their support. And let us know if they need follow-up information. And Kathy is on point to help collect all of that so we can use it. So that's the information you communicate back to us. We would also like you to follow up with your legislators after your visit. Send them an email. Repeat what our budget priorities are. You can attach the links to the Area Agency on Aging website because we have both of our one-pagers there. And you can attach them to your email or include the links. Either one works. In fact, the links are probably really efficient if they have some spam filter that doesn't want attachments. And I'm going to say thank you very much for your time, and we have plenty of time for questions. Lynn, shall I stop sharing so people can see each other?
Sure. And there is one question in the chat right now from Maria. Can you address, oh, it moved. Can you address how an advocate might respond if a legislator suggests that the governor's proposed 7 million is adequate?
I would just say, with all due respect, the governor's budget writers were moving really fast, and I think they misunderstood the information they got. We have backup data from the state agency saying that level funding for these services is 15.2 million. And the governor got the number of clients correct, and we need the correct amount of funding to serve them.
And I see a follow-up question as well. Alternatively, what can advocates say in response to legislators who say money is tight and we can't fund everything?
They always say that. They always say it. And I say, well, you know, then you've got some hard choices to make. And we really hope that you'll prioritize making sure that seniors get adequate food. It's really counterproductive for the state to make people hungry. I think it's a very basic thing that Senator Vandeweghe knows. He's works for as a first responder, that if you have a frail elderly senior person who's not got enough to eat, they're more likely to fall. And if they fall and have to go to the hospital, the chances that they can live independently or with supports in their home go way down, and it costs the state a lot more to support somebody in an assisted living or adult family home. So it's really counterproductive to cut back on nutrition services. Any other questions? I see a bunch in the chat. Lynn, I really appreciate you helping me. Okay, money's tight. We all know that money's tight. Okay, we got room for more questions, folks. And you can feel free to speak up if you want to. And I will put those budget sponsors into the chat as well.
Hey, this is Karen Kiesling in Pullman, and I have a comment. It's not on the two requests. I think they're very clear. I'd have no problem talking about them with the legislators I'll be seeing next week on Zoom.
Fantastic.
I continue to have this terrific concern about rural pharmacies because of Kaiser Permanente's mail order reaction and the attempts to stop it. And finally, Representative Schmick, who represents me and works in healthcare strongly, managed to get them to step back. But now they're moving back, and these pharmacy benefit managers who are hired simply to make more money for the pharmacy industry and not represent clients are starting to say again, well, you know, we are going to move back into requiring mail order. And I can tell you one personal experience that's horrible to me. 7 miles away from us in Moscow, Idaho, a pharmacy, market time drug that had been in business for 70 years closed its doors because it lost hundreds of clients through Kaiser Permanente's requirement. This is criminal. We need our pharmacies. They're our first line of defense. Getting it in the mail is not the answer. And for small, rural communities, it's a death knell. It's really a health and safety issue that's burning for me because I watch it around me. So just a comment to keep in mind.
I'm very aware of that in some of the work that I do with other clients of mine, and I would recommend that you share that story with the Washington State Pharmacy Association. They have a lobbyist. They've been working on this issue. They proposed legislation to address it last year, and I'm actually not familiar right now about their current strategy, but I would suggest you reach out to them because they are really the voice and the face of these small pharmacies pushing back against this problem.
Well, I see, Kate, you have a couple more questions that have come up. You have
Yes,
two
please.
hands, right? You have Kent Moline's hand is raised, and then Joanne.
And there's a couple questions also in the chat, so go ahead. Yes.
Go ahead, Kent.
Yeah, I was wondering if you could give me some context of my social work education 15 plus years ago. We talked about how many nursing homes have been closed because of the state's efforts to provide care at home. That, you know, these are old things, but when we're, you know, saying that the providing these services at home saves money, how much money, and, you know, in compared to a point in time and as a real dollar now?
My understanding, at least from some of the slide presentations we were doing a couple years back, that it's in excess of $4 billion that have been saved by reorienting our long-term care services towards people's homes. It is huge, absolutely huge how much money it saved. It's also preserved people's dignity and their ability to live their lives in a familiar setting, which is enormously more beneficial to people who are dealing with cognitive disabilities and dementia. It's also enabled people to stay connected to their communities and to provide actually people get more hours of hands-on personal care when they're living at home than they do in a nursing home. When you look at the overall averages, most of what people do in nursing homes is sit. They just sit. They may have some company, but they may not have company depending on how isolated they are by their disability. They were horribly isolated during COVID. It was just tragic what happened, especially to people dealing with dementia and cognitive disabilities during COVID in facilities where they were cut off from their family members, as well as from their loved ones, staff, and peers. So I think the people who were at home had a much, much better time during the pandemic. And, you know, we don't need that many nursing homes. We need nursing homes to care for people who need a nursing home level of care when they cannot be served at home, when it's not possible for the services available in the community to meet their needs. There are absolutely clients who have that level of need for services, especially technical, medical, nursing related services. But the argument that, oh my God, these nursing homes are closing because people are being cared for at home, that's actually a success story.
Right. The 4 billion that you mentioned, is that annually or over?
I think that's cumulative.
Okay.
And Kathy, that was from our Age Wave PowerPoints. That was like
Yes,
a long time ago.
that's
so-
over a period of years since we rebalanced the system and the focus was on community services. So you're looking at like 20 years.
Okay, thank you.
And I will brag that AARP has again ranked Washington #2 in the country for the quality of our long-term care system. And the fact that so many people receive their services at home is a huge factor in our high ranking. I see Joanne's got a question.
Yes, I just wanted, this may have been addressed, I didn't get it. Will the nutrition monies apply to people, younger adults with disabilities as well as to seniors?
Yes, it is for all of the people we serve with our nutrition programs.
Great, thank you.
Jean, do you have your hand up?
Yes, I do. Is there any, we're talking about case managers and how we don't have enough people who can be case managers. Are there any programs where they are going into schools, into high schools to train young people to go and help the people who are in their homes?
That is a great question. I'm going to do just a little check on terminology. Case managers are the people who work for area agencies on aging who typically have a nursing degree or a social work degree, who can manage, 75 clients and connect them to an incredible network of community services. The individual providers or the home care aides are the people in people's homes who provide that assistance with eating or bathing or dressing or using the toilet, managing medications, and so on. And yes, the legislature is trying to address the workforce shortage among those home care aides in a number of different ways. They've raised wages significantly. They've added additional benefits that they can earn when they're working full-time or even part-time. They have also extended training programs into the high schools for people who would be interested in becoming long-term care workers when they graduate, or just to provide the knowledge base and the training that they can need to care for a loved one safely and decide if that's a career for them in the future. So I don't offhand know the legislation that made that happen, but I think I remember seeing it last year, and I know that they're working in a whole bunch of different ways to bring people into the field.
Thank you.
Do you want me to ask you some of the questions in the chat, Kate?
Oh, sure. Yeah, sorry,
Sure.
I got stuck on the last bit. Okay,
No,
change on admin rate or waivers and retention bonuses. That's not a question I can answer, but Lynn, maybe you can.
And that is up to every area agency on aging. We all are local governments or within local governments, so we all handle wages and salaries differently. So there was a question, what's the best way to try and anticipate the questions a legislator may ask about our priorities during a face-to-face meeting?
It varies so much by who the legislator is, because some of them know a lot about this and some know very little, and some are incredibly sensitive to the issues of seniors and people living with disabilities, because some of them have been caregivers for their own family. Some of them have family who are receiving services now. Some of them have been advocates for people with disabilities. Some of them really don't know much of anything and are starting completely from scratch. So I think it depends on who your legislators are, and I would recommend, if you can, to look up their biographies. They are on the legislative website, which is leg.wa.gov. And it takes a little poking around, and maybe your lead for your area agency on aging can help you find the profiles. But each of those legislators has a homepage, and many of them have an about me or a bio link on that homepage. And you can find out that, oh, well, this person runs a small business and serves on the school board. And maybe this person has been working in urban planning for most of their lives, but is an avid sport fisherman. And maybe you can learn that this person, they've all got different things that they bring to it. And And then everybody at some point has had a loved one who's grown old or experienced a disability. So I think that there's going to be some sympathy there, but they just may not have a lot of baseline knowledge. I don't think they need a ton. Just having their support would be great. And nutrition, I think, is pretty easy. Everybody knows that being hungry is awful and painful.
Right, any other questions?
This is Kent. I'll do a quick clarification. The 2.58 million supplement we're looking at, that will be matched by the feds, but only if the state kicks in, correct?
Correct.
We are
So
asking for that amount from the state. The feds will not provide the match unless the state puts up its own money. Yeah, that's how Medicaid works. And the nutrition funding is general funds dollars. It is not Medicaid nutrition services. It is for everybody, regardless of their coverage, regardless of their eligibility, regardless of their status, regardless of anything. If you're hungry and you're in our service population, we will help with food services. So that is state dollars.
If I could make a comment, this is Karen in Coleman. I think it's important for us to remember that these people worked hard to get elected. They want to represent us. They want to do the job. And one of the things we can really be proud about in the state of Washington, which is so different from so many other places, is our legislators, senators, representatives across party lines are civil to each other. We need to be thanking them, first of all, for being there, working on solving our problems, being delighted to meet with us and hear our stories, and then ask them at some point, how can we help you do this job? It's a huge job, and we appreciate your being here, and we will stay in touch. So if there's something we can do to help you, let us know that.
Thank you, Karen. You've got some very effective legislators representing you. Joe Schmick is someone I honor and respect and have worked closely with in the past. And I really appreciate your warm relationship with him.
Right. Well, I want to do a huge thank you to Kate because she does this every year and always pulls everything together. And she does so much work for the area agencies on aging in the background. She just is one of those people, super smart, very well connected. We are just privileged to have her working with us as area agencies on aging. So thank you, thank you, thank you so much, Kate, for everything you do for us.
You are so welcome, and it is my honor and pleasure to represent you all. It is really amazing to carry such good work and share such amazing stories. Thank you especially to everybody who sent in those stories about your clients receiving nutrition services. We printed them on the back of our one-pager. Hey, Kathy, can we put the link to the one-pager in the chat for people?
It
Because I
is.
know it's on our website right now.
It is in the chat.
Oh, fantastic. I
There's
encourage
both,
everybody to click
both
on it.
case management and nutrition are in the chat, and they're all on the website. These slides will be on the website. We'll make sure that maybe the best thing for you to do is check with your AAA director because they'll have the email. And but you can just go like Rebecca did, just go right to the website. You can go to it directly yourself. The slides I don't think are there yet though, right, Rebecca? They'll be there later today. Yes.
Yeah. And
And
definitely,
honestly, if you want to share these one-pagers around with anybody, I'd say spread them far and wide. Share them with your friends, send them to legislators you aren't able to meet with, send them to anybody that you think might be moved to help out, because this is a coalition effort, and you all are our force on the ground, and you know far more people than I do. So please spread the word. especially about the nutrition ask. I think that one's much more digestible by the world at large, and case management's kind of small and technical. We could take care of that one.
And definitely, if you get a chance, go to the website and sign up for advocacy alerts. I always appreciate it during session. We send regular alerts as important bills or budget asks come up and we need help from advocates to reinforce points. We also send them on a regular basis for things that are happening on the federal level. So please, definitely, if you get a chance, go sign up to make sure you get those.
And Rebecca just put that link in the chat too, so thank you.
Okay, well, I think that brings us to a conclusion. Well, thank you everyone so much for everything you do for area agencies on aging and for advocating for older adults and people with disabilities across the state. We definitely could not do this without you.
Thank you. Look forward to seeing you in Olympia or online.
Thank you. Thank you, Lynn and Kate, for your leadership. We really appreciate it.
Thank you.
Thank you.